Hello and welcome to the Obstetrician's View, where we make pregnancy simple, clear, and safe. Today, we're talking about a condition that affects many pregnant women but is often misunderstood. That is gestational diabetes. If you've been diagnosed with it, you might be wondering, did I do something wrong? Will my baby be okay? What can I eat now? And if you haven't been diagnosed, you might also be asking, how do I prevent it? In this video, I'll walk you through what gestational diabetes really is, why it happens, what it means for you, what it means for your baby, and most importantly, how to manage it safely. So let's get into it. Gestational diabetes is a type of diabetes that develops during pregnancy. It means your blood sugar levels are higher than normal. Even if you've never had diabetes before, it can occur. And here is the key thing. It usually starts in the second or third trimester. And in most cases, it goes away after delivery. But while you're pregnant, it needs proper attention and control. So the question is, why does it happen? During pregnancy, your body produces hormones that help your body to grow. However, some of these hormones can block the action of insulin, which is the hormone that takes care of sugar in the body. When this happens, it makes your body less able to control sugar levels. This is called insulin resistance. Normally, your body compensates by producing more insulin. But in some women, the body cannot keep up and the blood sugar rises. So who is at risk of gestational diabetes? Some women are more likely to develop this condition than others. So you may be at higher risk if you are overweight or obese, if you have a family history of diabetes, especially in first degree relative, your mother, your father. If you've had gestational diabetes in a previous pregnancy or have had a big baby before, that's a baby over 4 kilograms. If you have been diagnosed with PCOS, that's polycystic ovarian syndrome, or are over 35. But here is something important. Even women with no risk factors can still develop gestational diabetes. So screening is essential for everyone. Most women with gestational diabetes have no symptoms at all. And that's why we rely on routine testing and not symptoms alone. However, in some cases, you may notice excessive thirst, frequent urination, fatigue. But these can also be normal in pregnancy, so testing is key. So how is gestational diabetes diagnosed? It is usually diagnosed with a test called the oral glucose tolerance test, OGTT. You'll be asked to fast overnight, a blood sample will be taken, you'll be asked to drink a glucose solution, and then your blood sugar will be checked over a few hours. This is typically done between 24 and 28 weeks of pregnancy. If your levels are high, a diagnosis of gestational diabetes will be made. So what does this mean for you? If not well controlled, gestational diabetes can increase your risk of high blood pressure in pregnancy, preeclampsia, difficult labor, cesarean section. And after pregnancy, you also have a higher chance of developing type 2 diabetes later in life. But here is the reassuring part. With proper care, most women have completely healthy pregnancies. So what does this mean for your baby also? Your baby is directly affected by your blood sugar levels. So if your blood sugar is high, your baby receives excess glucose, which can lead to macrosomia. That's when your baby's weight is more than 4 kilograms. This can make delivery difficult and increases the risk of birth injury. Your baby can also have low blood sugar after birth. Baby's body produces extra insulin, and after birth, sugar can drop suddenly. There could also be breathing problems, especially if delivery happens earlier than it should be. There's also increased risk of obesity and diabetes later in life for your baby. Again, these risks are significantly reduced with good control. So what can you do? This is the most important part of this discussion. So, 1. Eat healthy. Focus on whole grains, vegetables, lean proteins, and healthy fats. Avoid sugary drinks, processed snacks, excess refined carbs. Eat small, frequent meals to keep your sugar stable. Monitor your blood sugar regularly. You may be asked to check your sugar levels at home, following fasting, after meals, especially if a diagnosis of gestational diabetes has been made previously. This helps to guide your treatment. Physical activity is also very helpful. Simple activities like walking, light exercises help your body use insulin better. Also, medications may be necessary. If diet and exercises are not enough to control your sugar levels, then some medications can be given. You may need insulin or sometimes tablets. This is safe in pregnancy when prescribed properly. Regular antenatal visits cannot be overemphasized. You will need more frequent checkups, and your baby's growth will need to be monitored more closely. So, for delivery and after birth, your doctor will plan your delivery based on your blood sugar control, your baby size, your overall health, and then after delivery, blood sugar usually returns to normal. But your blood sugar should be tested again after about 6 to 12 weeks following delivery. And in the long term, you should maintain a healthy lifestyle to reduce your future risks. So gestational diabetes can sound scary, but it is manageable and is temporary in most cases. The key is early detection, good monitoring, healthy lifestyle, and working closely with your healthcare provider to achieve a good control. If you found this video helpful, don't forget to like, share it with someone who needs it, and most important, subscribe to the Obstetrician's View for clear, simple pregnancy guidance. I'll see you in the next video.